Today on the Women's Health Beat, Dr. Felice dives a little bit deeper into PCOS with her good friend, Sasha Ottey from PCOSchallenge.org. Hello, everyone. I'm Shane Schultz, the executive producer of the Zubia Live channel. Today, we have another great episode of the Women's Health Beat hosted by Dr. Felice Gersh. Dr. Felice is board certified in both as an OBGYN physician as well as integrative medicine. On today's episode, Dr. Felice dives deeper into PCOS with her good friend, executive director of PCOS Challenge, Sasha Ottey. But before we get started, we'd like to say thank you to our sponsor, Soluma. Soluma is your light therapy device that treats a variety of skin and pain conditions, including arthritic pain, facial wrinkles, as well as acne. If you'd like to learn more about Soluma, visit soluma.com. All right, without further ado, please welcome Dr. Felice Gersh. Dr. Felice, it's great to have you here today.
Well, thanks so much, Shane, and welcome to the Women's Health Beat, a show for women of all ages. I'm here today with my special guest, Sasha Ottey. Hi, Sasha. How are you doing?
Hi, Dr. Felice. I'm well, thanks. How are you?
Great. So we were just chatting before the show started about the condition known as polycystic ovary syndrome, PCOS. Now, I got familiar with PCOS way back when I was in medical school, but I didn't know much about it. And I discovered down the road, like many women, that I actually have it, but I had to self-diagnose. And I know you have a story, and so many women have their own stories of PCOS. I was wondering if you could tell us and our audience, because they don't know you the way I know you, and the amazing things that you're doing and the organization that you started, PCOS Challenge. Could you share a little bit about your journey and how you started this wonderful nonprofit called PCOS Challenge and what your mission is?
Well, thank you so much for having me today, Felice. I, like you, have a personal story with PCOS, or polycystic ovary syndrome. I was diagnosed back in 2008 by my gynecologist. I presented to her with my periods had stopped. This was very strange for me. I knew that something is wrong. So I went to her with this complaint. She did tests and then diagnosed me with PCOS. But she proceeded to say, don't worry, that many women and girls would love not having their periods.
Oh, no.
Completely dismissing my concerns about it. And gave me a pamphlet that told me a little bit about PCOS. And said, come back to me when you're trying to get pregnant. That wasn't even a topic of conversation at that point.
Oh, no.
And then she referred me to an endocrinologist who proceeded to tell me, come back to see me when you've lost weight in 6 months. So I asked him, well, can I go see a dietitian, a nutritionist? But my health insurance wouldn't cover me to see a nutritionist because I wasn't diabetic. Hence, my great disappointment with the healthcare system, my healthcare providers, just the journey to being diagnosed and the lack of actual treatment options that I received. After doing research about the condition, I realized that there were millions of other women and girls who were dealing with the same thing or worse. The lack of education and resources for us was daunting. So I decided to create PCOS Challenge, which is a nonprofit organization dedicated to increasing awareness and education about polycystic ovary syndrome. So this is how the organization came to be, and it has grown to over 45,000 members. Is now the largest nonprofit organization worldwide for women and girls with PCOS. So this speaks to the tremendous need that we all have for resources around PCOS.
Oh, well, that is both an amazing and unfortunately an incredibly common story. It actually matches my own, where I had no period for 2 years. And then I went and I said to a very renowned doctor in the department that I was training at in OBGYN as a resident, And I said, something is wrong with me. And he said, don't worry about it. Exactly the same thing. If you want to have a baby, then we'll deal with it. Otherwise, just go on birth control pills. So we have such a parallel path, except I went down the medical path and you went down the amazing path to create this nonprofit organization. Can you share a little bit more about the mission and what you're currently doing? Because as some people may know, but some may not, is I'm actually involved with you in the organization. I'm on the medical advisory board, and we've been working together on a very important mission. I was hoping you could share it with everyone.
Absolutely. Well, PCOS Challenge, the website is pcoschallenge.org if you would like to learn more. Our vision is that PCOS is treated as a public health priority. It affects millions and millions of women in the US and worldwide. It's a public health issue that historically hasn't been addressed. And so we're trying to change that. Our mission is to increase awareness about PCOS to help to prevent some of the lifelong complications, to reduce the risk for things such as diabetes, cardiovascular disease, and some cancers. These are some of the leading killers or causes of death in women. So one would think that this would be a priority. So that's our mission. And we have an impressive board, or three advisory boards. We have a patient advisory board. We have a health professional advisory board, and we have a medical and scientific advisory board, of which, Felice, you are a part of. It's a wonderful assortment of professionals, world-renowned professionals in polycystic ovary syndrome, who are dedicated to the mission of increasing education and research for PCOS.
Yes, it's exciting that there is so much hope and a future that we can look to. As you know, it is a worldwide condition, and that is like one of the most amazing things when we've been to some of these organizations that involve researchers, and we get together at these annual conferences. We meet people from every continent, and it's really exploding. A lot of people don't realize that PCOS incidence is really exploding in many, many areas of the world. For example, in India, I was really surprised at a recent conference that I was at, where a researcher gave a lecture and said that they're now estimating about 1/3 of women in India have PCOS. And in the United States, the numbers have varied anywhere from 10%, even up to like 20% of women. And yet, if we were talking about if we walk down the street and say, excuse me, do you know what PCOS is? Most people have no clue. And the ones who have heard of it don't really know what it is. So can you talk about what you're doing in terms of, at the Capitol, in terms of trying to get more funding for research and get the word out and get some real support for women with PCOS so we can move forward?
Well, Felice, you're right. I don't know if there's many other conditions or anything where the prevalence is so high, yet few people know about it, right? So one of the reasons that awareness is so important is that PCOS isn't being diagnosed or is being misdiagnosed, which is equally as bad. And so the healthcare community isn't well educated about it. The general population isn't educated about it. And of course, our legislators and leaders, most of them have never heard of it. Most of them have never heard of this. They didn't know this was a problem, right? So if PCOS is leading to diabetes, 50% will become diabetic or pre-diabetic before age 40. That's in your teen years. That's in your early 20s. And this is a huge impact on not just the healthcare system, but quality of life for the individual and their families. PCOS needs to be a priority. What we've done this year at PCOS Challenge is to work with our advisors and amongst ourselves to increase awareness on Capitol Hill. We've worked with Congressman David Scott in Georgia earlier this year to introduce House Resolution 495, which was the first of its kind to bring awareness about PCOS in the U.S. House of Representatives. It's currently the health resolution with the most co-sponsors this Congress. So there is huge interest on Capitol Hill and growing interest about PCOS. And more recently, we worked with, we brought it to the Senate, and Senators David Perdue and Elizabeth Warren introduced the S-Res 336, sorry. So we have both, houses introducing resolutions to recognize the seriousness of PCOS and also officially designating September as PCOS Awareness Month. So this is huge. This is historic.
What an amazing accomplishment, and it's going to mean so much to millions of women in the U.S., and that will have repercussions around the world. I think once it's recognized and it's, really respected, it's like you have to be respected as a condition, as an illness, right? In order to get researchers interested. Because if it's not something that people care about, why would a researcher want to do research in it? Because researchers have two agendas, right? They want to do something amazing and create research and have an impact, but they also want to forward their own career, right? And so they want to work on something that people are going to care about. And if no one seems to care about PCOS, then there are not going to be that many researchers wanting to get into that area. So I think this is going to have, a ripple effect, even a gigantic wave effect, throughout hopefully the research community, because as you and I both know, when we go to these conferences, and you and I are at conferences together on an annual basis and multiple times sometimes during the year, that we see how few researchers there really are that are really dedicated to the cause of advancing knowledge in PCOS. And because of that, we go year after year to these conferences, and when they talk about treatment, we don't see very much that they're talking about that sounds new, right? Or really a breakthrough, like where's the big breakthrough? So I think that this is going to have a tremendous impact for the future, and it's really amazing.
I'll just say a part of the issue surrounding research is that it gets such little research funding. So we're at this critical stage now where the prevalence is exploding, yet the funding for research is dwindling, and specifically for PCOS research. And that total NIH budget, PCOS receives less than 0.1% of the total NIH budget.
That's shameful. Absolutely.
It is, despite the fact that it's the most common hormone endocrine disorder in women. So, that's something that needs to change. And there's mostly one institute that's funding PCOS research, which is why most of the research on PCOS is about reproductive health. We do need to branch out into other aspects of PCOS, such as the, diabetes and, the cardiometabolic aspects of PCOS, the mental health aspects of PCOS. These need to be funded research studies, areas of research to benefit women and girls with PCOS.
Absolutely. And I also feel that because it's a female-only condition, although they're talking about it being, in males, it's really, they can't get into our camp here. It's really a female condition. Males can have metabolic disorders too, but this really is a female condition, and I think that has been a problem, as we know, because sometimes males are more dominant in terms of some of the research, in terms of distributing the research dollars, and so on. So I think, it's like a lot of us female power. We have to bring attention to it. And some of the really terrible symptoms people belittle because they don't see the huge ramifications to a woman's health. Has excessive hair growing on her face, or losing the hair on top of her scalp, or has recalcitrant, won't be treated, will not respond to the traditional treatments of cystic acne. These are tremendous problems for women. These are not frivolous little things. These can change the course of a woman's life. It can induce terrible depression, anxiety, social phobias, and so on. So these are huge problems. And the issue with weight gain, which is so prevalent in the community of women with PCOS, these are looked upon sometimes as just cosmetic or frivolous issues, but these are life-changing conditions and these manifestations of the disease that can change a woman's life just as much as having high blood pressure can change a woman's life. And because they are visible or considered cosmetic, I think they are belittled, and we really need to look at all the manifestations of PCOS. And it can fill 2 columns of all the manifestations of PCOS that we bring attention, and then we make it clear to everyone in the US and around the world that this is a huge problem, and we are looking for answers, and we are going to get them.
We are. There are so many issues surrounding PCOS. One of the most prevalent reasons is, we see multiple doctors for each of our body parts, right? PCOS has historically been thought of as a reproductive disorder, yet we know that PCOS affects every organ system in the body.
Every
right?
single, absolutely.
Every single one. So, you may see your gynecologist who may prescribe you oral contraceptives, which, may not be helpful if you're trying to conceive, but but who will prescribe to you oral contraceptives and may not even screen you for some of the metabolic disorders, right? You have your endocrinologist who may prescribe metformin and aren't really thinking about depression and how it's affecting you in your daily lives. So I think one of the major issues regarding PCOS is that integrative care is not commonplace, and that needs to change. We need to address PCOS holistically, every mind, body, spirit, in order to really manage and live our healthiest lives.
That is absolutely true. And that, by the way, is what I'm doing in my own center, is to create a comprehensive center, holistic center for women with PCOS, where we deal with every aspect of PCOS, from the cosmetic, which are so huge, to the metabolic, to the spiritual, because women with PCOS are affected in every aspect of their life and every organ of their body. As you said, we are trying to lead the fight on the medical side, and you're trying to lead the fight on the advocacy side. And that is why it's so wonderful that we are a team. It's just perfect. And I look so forward to the future and what PCOS Challenge is going to be accomplishing and helping me to get the research, that will then help me to have the tools to help all of my patients with PCOS, and to get the women with PCOS come out of the shadows, right? And be acknowledged as having a really significant condition that deserves attention, and that the old treatments as well, of birth control pills and metformin, they're not cutting it, We need to branch out and include many, many more therapies and make them more mainstream. We talk about a lot of the other different nutraceuticals that are having a major effect, and we can talk about that down the road, in another show, because you and I are aligned in terms of our views of treatment as well, just given the current knowledge. Because the toolbox that the conventional doctors are using is really tiny, and certainly not getting the results that women with PCOS really deserve. Because women, as you said, spend years searching for the reason for their problems, and then when they finally do get diagnosed, and some never do, but when they do, then they're given the same treatments that have been around for decades that really aren't getting to the root cause at all.
Well, PCOS is a syndrome. It's not a disease. It's a syndrome, and it presents differently in each person. We can line up 10, 20 women who each have a different, a composition of PCOS manifestations. So I may have had, and it changes over time, Felice. So I may have had, irregular periods at one time, but now they're more regular, and, have more weight gain, or, so this, it morphs, it changes. And so there's no one treatment that treats you for the entire span of your life, right? And there's no one treatment that treats everyone the same. So it needs to be an individualized and integrative approach.
Right. Yeah, the cookie cutter approach does not work. And of course, it's about the leading cause of fertility problems in women. And that's not a small problem when you're the woman and can't have a baby, because that is one of the main things that brings joy to many people in their lives. Mm-hmm. So PCOS affects women from the beginning, through their whole lives. And in fact, we now know that PCOS is probably actually there in childhood, right?
And the egg, right?
It's from right in utero, things are happening that are setting the stage for PCOS, and then it sort of explodes usually around puberty and in the years after. So together, you and I, we're going to keep on this path, right, Sasha? And
we're going to fight the good fight.
We're going to do it. And I can't wait to see what the outcome is on Capitol Hill with all of your hard labors. And I think it's going to be really just the game changer. Don't you agree?
So I agree. I think that this, we're in a unique situation. These are unique times where we have access to each other, right? We have access to, with the advent of social media, we can connect with each other. But we do want women to feel empowered to now speak up. We had hundreds of our members email us letters for their senators and for their representatives on the Hill, which have been making a difference, a huge difference. They want to hear from you. This is your opportunity. This is the first time that there has been a central focus on PCOS in the U.S. Congress. So now use this as your forum to let your representatives, your senators, know how PCOS affects you, how PCOS affects your family, and how it affects your life, your livelihood. It affects people's careers, if you have, it does. So PCOS has far-reaching impact, and this is your opportunity. So write into PCOS Challenge, email your letters, go to pcoschallenge.org/resolution and send in your letters, call your representatives. We are your advocates, but we also need you. We also need your help. We also need your support. We can't do it alone. This is the time. This is your time to come from out of the shadows. One of the reasons PCOS hasn't been well known is because we were so hush-hush about it for decades, right? Now is our opportunity to speak up, to walk together, to march together, on Capitol Hill, which, stay tuned, PCOS Challenge will be organizing Advocacy Day in 2018. So, come to Capitol Hill with us. Let our representatives know that this is important and PCOS should be a priority.
Oh, I love that. And I plan and hope to be there with you on Advocacy Day. And along with the idea that women have a voice, they should have a voice. I was in the shadows myself. I didn't talk about it out in public either. But now we are, out there. We are going to join together with our big voices. But one by one, like you said, we're united with a big voice, but we all have our own individual voices. And as part of that, Zubia Live now is having a wonderful advocacy of their own. They are now joining with you, and every woman that comes forward and gives their story on Zubia Live for 10 minutes just to tell their personal journey as a PCOS woman, then Zubia Live will donate $10 to PCOS Challenge to further your work to get PCOS out there and work with the people on Capitol Hill to educate them, to help us back. So I hope all of you who are out there who have PCOS will go to Zubia Live and will put their story, you put your own story on and tell the world about your journey with PCOS and help to contribute to the cause, because Zubia Live will donate $10 for your story. So they're calling it 10 for 10, 10 minutes of your time, $10 for PCOS Challenge.
That's awesome. That's phenomenal. Thank you so much. We absolutely need support in terms of, people speaking out, people joining us, volunteering, but we need financial support. There's almost no funding for PCOS. So we've been doing it on on a shoestring budget for the entire time of our existence.
Well,
So.
I think the tide is turning, and we'll be there together to see it, and we'll see this beautiful new future for women with PCOS. And Sasha, thank you so much for joining me here today. And I look forward to staying connected, and we'll work together. And hopefully everyone out there will now join us, right? And join PCOS Challenge and join this movement to help women with PCOS have a brighter future. Thank you so much, Sasha, and have a great day.
Thank you so much for having me, Felice.
What another wonderful episode of the Women's Health Beat here on the Zubia Live channel. We'd like to say thank you to Sasha Ottey, the Executive Director of PCOSchallenge.org. And we certainly hope that the Zubia Live 10 for 10 Challenge will not only bring awareness, but also some funding to a topic and subject that might affect you. In fact, if you have a health and wellness story or topic that you would like to share with the Zubia Live community, download our live stream app at our website, zubialive.com, or your favorite app location. But for now, we'd like to say thank you for watching, and we'll see you again soon.
So Celluma is probably the most innovative light therapy device on the market. It's FDA cleared for 9 indications for use, 3 of those on the aesthetic side and 6 of those on the pain management side. So it's really a whole body, whole family device. Anybody can use it, and it's great for upregulating cellular activity that's been compromised either due to illness, disease, trauma, bad behavioral habits, or just the normal aging process.